Welcome to Chapter 10, the Muscular System, Part 4 of 4. In this presentation, it will follow the same suit as the last few in that you will see a number of muscle tables with the name of muscles, the description, the origins, insertions, and actions. The table is usually followed by an image. Maybe pause at that point in time and take a moment or a few moments to review the muscles that you just learned about. In this lecture, we will focus on muscles of the lower limb, so muscles that move the hip, the thigh, the knee, as well as the ankle and the foot. The lower limb is similar to the upper limb in that we can compartmentalize muscle groups. The arm had an anterior and a posterior compartment, and so did the forearm. The lower limb gets a little bit more detailed because there is usually greater muscle mass in that body region. The thigh now can be divided into an anterior compartment, a posterior compartment, and a medial compartment. Think of that medial compartment as your inner thigh. The anterior muscles all function to produce some or all of the actions listed here, such as flexion of the thigh at the hip and extension of the leg at the knee. So if you are going to perform hip or thigh flexion, think about bringing your thigh up towards your trunk. And extension of the leg at the knee, think about kicking a ball or just straightening your leg. The medial compartment, all of those muscles are responsible for adduction of the thigh. Kick your leg out to the side and bring it back towards midline. That is adduction. The posterior compartment now, some of you may know as the hamstrings, all function to extend the thigh at the hip and flex the leg at the knee. When you extend your thigh at your hip joint, you are moving your thigh posterior, straight behind you. And when you flex your knee, think about kicking your butt or bending your leg. All of these groups are covered by the same sheet of connective tissue known as the fascia lata. Again, this connective tissue serves as a sheath to ensure that these muscles are functioning together and uniform. We'll start by talking about two muscles, and here you could take a moment to pause the presentation and identify the three muscles that we just learned everything about: the iliacus muscle, the psoas major, and the sartorius. On this slide here, you could see that the iliacus muscle lives in the iliac fossa. The psoas major muscle comes from 5 lumbar vertebrae. Both of those muscles insert onto the lesser trochanter, not seen here on the femur, and produce hip or trunk flexion. And lastly, we talked about sartorius. Sartorius comes from the ASIS and inserts onto the medial aspect of the tibia. Now we will actually move into the thigh. The muscles listed here make up the medial compartment, or the inner thigh. And lucky for you, most of them have the term adductor in their name, which probably means that they function in adduction. Adductor magnus, magnus meaning big. This muscle is so big that it actually encroaches into the posterior thigh. It comes from the ischium and the pubis, so 2 parts of the coxal bone, and it inserts onto a very special bone marking known as the adductor tubercle on the medial aspect of the distal femur. Its action is thigh adduction. Next, adductor longus. This muscle's probably long compared to the others, coming from the pubic bone and inserting onto the femur. Next, adductor brevis. Remember, brevis means short. Also coming from the pubic bone, inserting onto the femur. And lastly, gracilis. The term gracile means thin and straight, like a blade of grass. This muscle comes from the ischium and the pubis and inserts onto the tibia. Either way, all four of them adduct the thigh. Here's your chance to pause and take a moment to identify the last four muscles that we talked about making up the medial thigh. These are anterior views, so you want to shift your attention sort of to the right of each diagram, where you would find the medial thigh. Take a moment to find Adductor Magnus, best seen on the left, Adductor Longus, Adductor Brevis, and Gracilis. All four muscles found in the medial thigh will produce adduction. This table now will introduce to you the 4/5 muscles that are found in the anterior thigh, or the anterior compartment. They are collectively known as the quadriceps, minus one of them. First, we have rectus femoris. Rectus means straight, femoris means femur, or thigh. This is the most superficial muscle, just deep to sartorius. This one is different than the other three quadriceps in that it is the only one to cross the hip joint. The rectus femoris muscle originates on the anterior inferior iliac spine, and they all have the same insertion. They all insert onto the tibial tuberosity via the patellar ligament. All four muscles come together to create this tendon. The tendon envelops the patella. From there, we have more connective tissue running from the patella to the tibia, the patellar ligament. Since the rectus femoris crosses both the hip and the knee joint, it will have actions at both joints. The rectus femoris will flex the thigh and extend the leg, best seen in kicking a ball. Next, vastus lateralis. It's probably on the lateral side, coming from the femur and also inserting onto the tibial tuberosity. The other three muscles do not cross the hip, therefore they will not affect the thigh or the hip joint. Vastus lateralis will extend the leg. Think about straightening your leg. Vastus medialis on the medial side, coming from the femur, inserting onto the same spot as the other two. Leg extension. And lastly, vastus intermedius. Remember, when something is intermediate, it is between structures. The vastus intermedius is deep to rectus femoris and in between vastus lateralis and medialis. And lastly, this muscle is not a quadricep. It is the tensor fascia lata, or the TFL. This is found on the anterior and lateral aspect of the thigh. It's a fairly short muscle. It's coming from the iliac crest, and it inserts onto the IT band, or the iliotibial tract. The IT band is a sheet of connective tissue running from the ilium to the tibia. The TFL muscle will flex and abduct the thigh, or take it away from the midline. Maybe pause the lecture right now and take a moment to identify the 5 muscles that we just talked about that comprise the anterior thigh. We have the 4 quadriceps, rectus femoris, vastus lateralis, vastus medialis, and vastus intermedius, best seen on the right image. In addition to those 4, we also have tensor fascia lata, contributing to the anterior thigh. Moving along to the posterior aspect of the hip, the thigh, the knee, we have 3 gluteal muscles in the gluteal region. The largest and most superficial is known as the Gluteus Maximus muscle, coming from the ilium, the sacrum, and the coccyx. The Gluteus Maximus muscle inserts onto a very special bone marking known as the gluteal tuberosity on the posterior femur. The gluteus maximus muscle is going to extend the thigh. So think about going from a seated position to standing, or the action that you would see in a squat. Next, gluteus medius. Medius is in the middle, coming from the ilium and heading to the greater trochanter. The gluteus medius now, since it's more lateral on the hip joint, will pull that femur out to the side, producing abduction of the thigh. Gluteus minimus, the deepest and the smallest of the three gluteal muscles, also coming from the ilium, heading over to the greater trochanter, abduction of the thigh. And last but not least, we bring this last muscle in because it's extremely relevant in the clinic, whether it's in physical therapy or muscle rehab or athletic training. The piriformis muscle. It's very deep and it's often referred to as a lateral rotator. The piriformis muscle comes from the anterior aspect of the sacrum and heads straight out laterally to insert onto the greater trochanter. Because of its orientation, it's going to laterally rotate the thigh. This muscle can often cause issues known as piriformis syndrome and can eventually lead to sciatica, or issues with the sciatic nerve in the posterior thigh. On this image here, or more so on the left, take a moment to identify the gluteus maximus, coming from the ilium, the sacrum, and the coccyx, as well as gluteus medius. Again, gluteus maximus is the larger of the three muscles, and it is the most superficial. In the right image now, we have cut away a bunch of things. So try to orient yourself. Figure out what's there, what's missing. We have cut the gluteus maximus. We have cut the gluteus medius to expose the deeper muscles like gluteus minimus, as well as piriformis. The last compartment of the thigh is the posterior compartment, comprised of the hamstrings. But you may not have known this. The hamstrings include three muscles: the biceps femoris, semitendinosus, and semimembranosus. Biceps means two heads, femoris means thigh. So you have biceps in your arm and biceps in your thigh. The biceps femoris muscle is the most lateral of the hamstrings, and it comes from two heads, the ischial tuberosity and the femur, and inserts onto the fibula. All three hamstring muscles originate from the ischial tuberosity. That is extremely important. And lastly, the biceps femoris will extend the thigh and flex the leg. Maybe take a moment to stand up, place your hand on your posterior thigh, and demonstrate that action. See if you can feel your hamstrings contracting. Semitendinosus, coming from the ischial tuberosity, inserting onto the tibia, produces the same actions. And same as semimembranosus. Here we have another image of the posterior thigh. Maybe pause and take a moment to identify the three hamstrings. In addition to being able to identify muscles, be sure you orient yourself to these images. You may see them on exams, and they most certainly will not be labeled. So take some time to figure out, is this anterior? Is this posterior? Is this medial? Is this lateral? Is this a right or a left lower limb? Look out for the patella. The patella will tell you if it is an anterior view. Look for the gluteus maximus. That is most definitely posterior. Continuing distally down the lower limb, let's talk about the leg. Remember, the thigh had an anterior, a posterior, and a medial compartment. The leg, knee to ankle, has an anterior, a posterior, and a lateral compartment. While we will still see a little bit of flexion and extension at the knee in the leg, We will mostly focus on movements at the ankle, like dorsiflexion and plantar flexion. We will see movements within the tarsal bones, known as inversion and eversion. And then we will briefly touch on flexion and extension of the digits, or of the toes. Again, review these actions and try them on yourself. We will start with the anterior compartment of the leg, often referred to as the shin. The first muscle is the tibialis anterior muscle. That is probably anterior to the tibia, or the medial bone of the leg. It originates from the tibia, and it's going to cross the top of the foot, but also dive under the foot to insert onto the medial cuneiform and first metatarsal. Put your fingers just lateral to your bony shin and move your foot up off of the ground. That is dorsiflexion, and the muscle that you feel moving or contracting is the tibialis anterior. Because the tibialis anterior muscle crosses the medial part of the foot, it also helps with inversion. Next, we have extensor digitorum longus. Just by looking at that name, that muscle is probably long, but also extends the digits. It's going to insert onto the middle and distal phalanges of the last 4 toes, and it will extend the toes and help with dorsiflexion. Lastly, extensor hallucis longus. Remember, the hallux is the big toe. Extensor digitorum longus extends the other 4 toes. Extensor hallucis longus takes care of the big toe. Take a moment and maybe pause the presentation. Here you are looking at an anterior view of the right leg. Look for the patella. Look for the bony tibia exposing itself. Identify the tibialis anterior, the extensor digitorum longus, and note that the extensor hallucis longus is mostly deep to those 2 muscles. Moving into the lateral compartment of the leg, there are 2 muscles that you have to know: Fibularis longus and Fibularis brevis. Longus means long, brevis means short. Fibularis meaning the fibula, or the lateral bone of the leg. Fibularis longus is coming from the fibula, and it's going to pass over the lateral aspect of the foot now to insert onto the medial cuneiform and first metatarsal. Actions will be plantar flexion and eversion. Fibularis brevis, for the most part, it's similar, coming from the fibula, but it doesn't go as far. It stops at the 5th metatarsal. And now, if you take your hand and run it along the lateral edge of your foot, you feel a very prominent bump. This is actually the tuberosity on the 5th metatarsal, which is where the Fibularis brevis muscle inserts. Here you are able to identify the 2 muscles found in the lateral compartment of the leg. In the image on the left, you have a very superficial view where you are able to see Fibularis longus and a little bit of Fibularis brevis. In the image on the right now, everything has been removed. You are able to see the origin of the Fibularis brevis on the fibula, as well as its insertion onto the 5th metatarsal. And to finish chapter 10 and to tie everything together, we will take a peek at the posterior compartment of the leg now. 3 muscles that you are responsible for. The first is the Gastrocnemius. This is often referred to as your calf. This is the most superficial muscle, and it's interesting because it crosses the knee joint as well as the ankle joint. The gastrocnemius originates at the femoral condyles, both medial and lateral, and inserts into the calcaneus via the calcaneal tendon or via the Achilles tendon. The gastrocnemius will help with knee flexion because it crosses the knee joint, but it mostly functions in plantar flexion. So think about doing a calf raise or going up on your toes. Deep to gastrocnemius now, we find soleus. Soleus means flat fish. This is a broad and flat muscle coming from the leg now, so the tibia and the fibula, but it also contributes to the Achilles tendon to insert onto the calcaneus. It does not flex the knee because it does not cross the knee joint. And lastly, tibialis posterior. Posterior to the tibia and deep to soleus. Coming from the tibia and the fibula, it's going to course by the lateral malleolus on the fibula by the ankle joint to insert onto several tarsal bones as well as several metatarsals. It functions in inversion and plantar flexion. Now is your chance to study the 3 muscles that we just talked about. Maybe pause your screen and take a moment to walk through the origins, the insertions, and try the actions on your own. On the left here, we have a very superficial view where you are able to see the gastrocnemius and its 2 heads coming from the femoral condyles. In the middle image now, we have cut away much of the gastrocnemius to expose the soleus. And in the image all the way on the right, we have a deep view of the posterior leg where we can identify tibialis posterior. Again, this was Chapter 10, Part 4. As you study Chapter 10, make sure you know the information in the tables, but be able to apply that information to the images provided for you.